As an infrastructure organisation, and our main role is to pick up what is needed to be done in the area. So our work program is basically very fluid around the needs. And in Thurrock we realised that real professionalism, and by I mean the training courses or the opportunity to do the at a professional level stuff to get into higher jobs is very, very low in Thurrock, and especially around young people and the families. CVS, as an organisation, we don't work with children, but our intake into it is around workforce development, by which means by this initiative we create awareness of how important it is for young families and young people to get some. There's going to be another 80,000 more homes in Thurrock. Families are moving in, at least another 20,000 more jobs at a senior level. So we don't want Thurrock people to be stuck into kind of junior kind of jobs. We want to make them ready for the opportunities coming on horizon.
So what you're saying is that CVS is part of a much more aspirational Thurrock? Certainly. It's a more. What is Thurrock been described? It's a very exciting part of the country, is more opportunities but less aspiration. It's because of the kind of jobs people have managed to get over the last 20 odd years. So what as a CVS is an infrastructure organisation, and our natural role, we work with voluntary community sector organisation, faith-based organisation, PCT and the local council. We're trying to bring that aspiration to a level whereby people feel like, let me engage into professional activities and get some real sort of jobs at a much higher level than being kind of at a
decision-making level. And also to get that and achieve that, you need to have new and relevant activities and ways of reaching that as well.
Building foundations and encouraging strong community support. And we feel if those things are in place, then the rest of it can follow, as well as many activities that are provided.
Well, we trust the whole 0 to 19 agenda, so we thought we'd do really flash and look at the 5 outcomes as well, just to show off. But what actually came up for us was consultation was key, because if we don't actually consult with communities and the users, then we might as well just go home really. And about raising awareness of what services there are, but actually looking at the gaps as well that there aren't. We talked a lot about effective cross-agency working, that actually we really couldn't meet this agenda without working across all the agencies. And we actually felt that choice was a biggie here, and that not one size fits all, someone said, which we thought was a very good sort of little question.
Trust and long-term relationships, which actually link with consistency. One of their concerns was about groups that are here tomorrow, gone the next day, because there isn't sustainable funding in place. So having that consistency.
And there's the PCT of the best tables, I think. And what we actually talked about is the behavioural education support team have actually just been set up for 3 weeks, and they're looking for 17 members, and they're a pilot programme based on gaps that have been identified over the last 3 years. And what we talked about was that how that information from schools got filtered up to obviously the council, and how the service has been implemented, and it's about how important it is that anybody here today who identifies the needs that are there, that communication is essential. And we talked about the communication aspect of it to get something like the best team up, which is what's happening.
Organisations covering wide age groups as well, from early years, faith, health, council, 14 to 16, and also covering a diverse population. And what they felt that they could engage with, everybody felt they engaged with some part of those priorities, and they had input into those. But this group would offer opportunities to network with other groups and find out what other services are, and they would like to know what the other services are. When I said about the Ask Thurrock website, which does exist but people aren't aware of it, so through this group you might be able to know about that existing, plus also make sure that your services are represented on there correctly. And then the other thing was that to have an influence on the targets, because it was felt that perhaps the achievement targets do put stress onto children and young people, and to get a balance between that and the enjoy part, so that we ensure that they've got mental well-being.
Communication. Really, that we've got some good ideas of how we think we can improve communication, but we really just felt that communication was the key, and today, even around the table, getting to know each other was really, really helpful.
Lovely, thanks.
Thank you.
2 points from quite a lively discussion. One is the fact that there are already small groups through the borough that are doing this. This is not new. Some people have been doing this for a long time, supporting families, supporting people within their individual communities, whether that be a small church-based group or a large group. But some people are doing this and have been doing it. Not necessarily capable of scaling up, nor actually why would they want to scale it up. But there are lessons to be learned from some groups and some people who have been doing work like this for a long time. And we ought to be trying to learn some of those lessons. The other key bit for us is youth. I can't influence my kids after the age of 14 very much because it's their peers. Look around you. In terms of sitting down and influencing teens particularly, you need teens. We need youth ambassadors. We need to find a cadre of young people that will go out and talk to other young people in the same language, in the same context. If they're going to be influenced, use their peers. There aren't many of us here who carry that much credibility with teens. So some sort of youth scheme, finding some peers that we can train up, youth ambassadors.